Okay, folks, we're going to get started here. All right. I want to thank you all for coming. My name is John Sillers, and I am the Vice President of Resource Development and Marketing here at Volunteers of America, Southeast Louisiana. I'd like to ask all of you to please mute yourselves if you haven't already, so we can hear the speakers loud and clear. Really appreciate that. Here at Volunteers of America, we serve a multitude of vulnerable populations through over 20 programs, but today we want to take a deep dive into how Volunteers of America addresses intellectual and developmental disability services. This is really important work, and we've been at it for a long time. We opened our first group home in New Orleans in the 70s, and so it's near and dear to us. It's so important that we work with multiple angles, providing care for people with intellectual and developmental disabilities in their homes and in community group homes, as I just mentioned. I'd like to introduce Volunteers of America, Southeast Louisiana's President and CEO, Boris Vigi. And I would once again,
and I want to go through, read that, make sure that that's.
And you could all please mute yourself.
And then I want to review this because I don't think we need to include some people.
Thank you. Okay, Boris, take it away.
And good morning, everyone. And thank you once again for attending our 6th community forum. I want to give special thanks to State Representative Rhonda Butler, Carolyn Meehan from the Community Provider Association, and Kathy Dwyer from the Louisiana Dental Task Force for Adults with Developmental Disabilities. By engaging new members and members of our community, and along with public officials and donors, we hope to find new needs and opportunities, with the people we serve being the ultimate beneficiaries. At the same time, we love spreading the word about the work that we do. More than 47,000 of the most vulnerable in our community receive support and care from Volunteers America. And what does that mean? And what does it mean to take care of the men and women and children in our community? Well, this year we have a funding gap, and that's increased as a result of Hurricane Ida. We understand that the work that we have to do for the children, the veterans and seniors, and those who struggle with addiction and so many more is extremely important work. It's not an impossible climb, though, when we have people like you who are attending today to understand and educate yourselves about the work that Volunteers of America is doing in the community every day, and believe in Volunteers of America's mission. And we truly appreciate that, because we know that when you learn what we are doing in the community, and we're doing it in order to pay it forward and serve the least of our people, then we know that you have become ambassadors of Volunteers America. So today's discussion is about how Volunteers America is going to support folks with intellectual and developmental disabilities. So you'll learn a little bit about Community Living Services Program and our Supported Living Services Program. The work done by these folks ensure that every person, no matter of their ability, is able to live each day with dignity. And now I would like to introduce our Director of Government and Community Relations, Nick Alvarez. Nick?
Thank you so much, Boris, and thanks everyone for being here. I see we've got up to 46 participants this morning, and I'm really excited about this discussion. It shows how important it is for our community. Now, as we get started, I want to remind you to keep yourself on mute. If you have a question, please place it in the chat, and I will get to as many questions as possible throughout today's session. And I may try to combine questions that are similar, but I really want this to be interactive. So as we go throughout today's session, if a question comes to mind, please place it in the chat. So we're going to get started, and I'm going to allow our panelists to introduce themselves. And first, I would like to call on Representative Rhonda Butler. Representative Butler represents House District 38 in the Louisiana House of Representatives, and she has been a tireless advocate for people with intellectual and developmental disabilities. This past session, she championed a bill that brought dental care for those receiving home and community-based services who have an intellectual and developmental disability. So at this time, I'm gonna let Representative Butler introduce herself and give just an opening statement.
Good morning, everyone. Yes, I'm Representative Rhonda Butler. I represent District 38, which covers Evangeline Parish and North St. Landry Parish. And I'm definitely an advocate for these adults of disabilities and children due to the fact that I have a special needs child. And, you know, we're supposed to follow our own path. And I wasn't quite aware of that's what God put me here for. And when I got into this race and I got into this chamber with everyone in there, they became so supportive of me passing bills that we needed so desperately for these special needs adults. And so I went for it, and it turned out to be such a great thing in the end. And hopefully we have more to come. I have a lot more to come, but thank you for having me today. And I'm so grateful to be here.
Thanks, Representative Butler. We definitely look forward to your contributions to the discussion. Now I'm going to have Ms. Kathy Dwyer introduce herself. And Kathy Dwyer serves as the chair of the Louisiana Dental Task Force for adults with intellectual and developmental disabilities. And she also serves as the chair of the Louisiana OCDD State Advisory Committee. So I'm going to turn it over to you, Ms. Dwyer.
Thank you, Nick, and thank you for inviting me to participate in this forum. I, like Rhonda, am the mother of a beautiful 44-year-old young lady with multiple disabilities, and started advocating because of my daughter. She pretty much gave me purpose in the path that I wanted to go on. I started off when she was in the early intervention program, participating in a parent advisory group. And then I started working for LSU Health Sciences Center, Human Development Center, and retired from there after 25 years of service. But I didn't retire completely. I wanted to continue my work in the developmental disability advocacy area. So I worked for about 5 or 6 years with families, helping families of Greater New Orleans, and about the same for Autism Society of Greater New Orleans. Now that I'm fully retired, at least not getting paid, I have been actively working with Jefferson Parish Regional Advisory Council, and as you mentioned, the State Advisory Council, and now the Louisiana Dental Task Force, which we are very grateful that Representative Rhonda Butler responded to our call to help us pass a bill for those services. So thank you, Representative Butler, again.
Thank you so much, Kathy. And I'm now going to turn it over to Ms. Caroline Meehan. Caroline serves as the Executive Director of the Community Provider Association, which represents a number of providers that provide services to people with intellectual and developmental disabilities. Caroline.
Thanks, Nick. Had to unmute myself. Good morning, everyone. Thank you for having me at this forum. So as Nick said, I'm Caroline Meehan. I'm the Executive Director of the Community Provider Association, or the CPA for short. And the CPA is Louisiana's statewide advocacy organization for disability service organizations. So that includes community homes that were mentioned earlier, home and community-based services, which are often called waiver services, and support coordination, which are case management services for individuals with disabilities receiving home and community-based services. So we are, as I said, statewide. We have about 40 member organizations across the state, including Volunteers of America. And we, our primary function is to engage in advocacy at the federal level and the state level, working with legislators like Representative Butler and advocates like Kathy on disability service issues. And we also provide education and networking opportunities for our members. So glad to be here today. Thank you.
Just a reminder to everyone to mute your lines if you're not speaking. And thanks so much, Caroline, for that introduction. And finally, for our panelist introductions, I'm going to turn it over to Heather Matthews. Heather serves as the Director of Supported Living Services here at Volunteers of America, Southeast Louisiana. And she'll talk a little bit about our program here at Volunteers of America.
Heather, you are on mute.
Does this work? Okay, cool. Thanks, Nick. I was just saying how excited I am to see so many of our community partners and stakeholders out there. I see some familiar faces I haven't seen in a while, and I'm excited that y'all are here today. My personal story is I am a sibling of 2 individuals with developmental disabilities, and I have been working at Volunteers of America as the director of our waiver program. We serve about 80 individuals in Southeast Louisiana, primarily Orleans, Jefferson, St. Bernard, and St. Tammany parishes. We have a great staff who goes out every day and takes care of them in their homes and delivers services they need just specific for them in their homes, in their workplaces, in their school sites, or wherever they're needed. That's the quick one too of what I do.
Thank you so much, Heather. Well, we're going to dive right in, and I'm going to have some questions. And again, if any questions come to mind throughout the conversation, please do put those into the chat. So I want to start out with just a question to all of our panelists. What is the status of the Developmental Disability Service System? I know we've got people on this call who have probably different levels of understanding of the system and where things stand. And if you could just give an overview of some of the challenges, some of the opportunities, and some of the trends that you're seeing within developmental disability services. And so Caroline, maybe you could start us off.
Sure, I'd be happy to. So just I don't know everyone's familiarity with the system on the call, but just kind of a quick overview. I think of the disability service system as having 3 main components. So one of those is what are called intermediate care facilities, or ICFs, and these are residences where people with developmental disabilities live in community together. There are also home and community-based services, or waivers. Those are the services that Heather was just describing, where individuals with disabilities live, on their own or with family and receive supports there. And then there's support coordination, which are case management services to be sure that people who are receiving home and community-based services can access all the community resources they need. So those are kind of the pieces of the system. In terms of the current status, I mean, to be very frank, I think the system is challenged. It's challenged in most states across the country. I think Louisiana's system has some specific challenges. I will say, I think we've made great strides in recent years with this system, especially with the help of the legislature and champions like Representative Butler and advocates like Kathy, and with the leadership of the Department of Health. I think we just need to keep going. There's still so much more to do. And as you can imagine, the pandemic has really exacerbated the existing challenges within the system. Just to mention a couple of the challenges, funding is the biggest challenge that the system faces. And this is because these services are funded by Medicaid dollars at the state level, finite amount of Medicaid dollars to go to all the programs that need it. And reimbursement rates for these services at the state level are frankly out of date, and they're not increased or reviewed at regular intervals, at least at this point. And so it's pretty hard for organizations who provide these services to keep up with expenses and to retain the workers that they need. And I know Heather can talk more about that because she lives it day to day. So I think another thing to keep in mind, so there's the overall funding issue. There's also the issue of inequitable funding among the different components of the system. So community homes are funded in a different way than home and community-based services and support coordination services. And in a lot of cases, the different program types are trying to recruit from the same pool of workers. And if those programs aren't funded equitably, it's hard to recruit equitably and be sure that everybody in Louisiana with a disability, regardless of where they live, receives services from a stable workforce. So that's kind of my, I think we do have some support at the federal level, specifically for home and community-based services, which has changed the landscape at the state level a little bit. But it's kind of an unstable, uncertain future in the long run due to the funding issues that I mentioned. So I'll stop there.
Thanks, Caroline. And I guess just a really quick follow-up, just so that we have it out there. I know that the CPA has a legislative agenda for 2022 that corresponds with some of those needs that you mentioned in the service system. Could you just lay those out so that everyone knows what your organization that we here at Volunteers of America are a part of are going to be working on as we look forward to the 2022 legislative session?
Yep, absolutely. So we are going to have a funding or appropriations request for the legislature. The first one related to home and community-based services is to, just backing up a little bit, in this year's legislative session, the legislature approved a rate increase of $2.50 an hour for home and community-based waivers for people with intellectual and developmental disabilities. We're going to be asking the legislature to keep that money in the budget, basically for the coming year. We're also going to be asking for an appropriation for ICFs, for community homes. ICFs did not receive a commensurate increase in this year's session, and we want to be sure they're not left behind, and the individuals who live in ICFs aren't left behind. So we'll be asking for about $8 or $9 million state general fund. We're also going to be asking for an appropriation for support coordination services so that support coordination agencies can hire and retain the staff they need to coordinate all of the services. A couple other things I just wanted to mention regarding the workforce issue with folks. We call them direct support professionals, or DSPs. These are the individuals who are going in and doing that hands-on support for people with disabilities. We're always looking for ways to kind of expand that workforce, expand the pool of people who are interested and able to do that work. Something that I've found in talking to providers, and again, I think Heather could probably speak to this, is there are these barriers to entry into that workforce that we think we could find some solutions to at the state level. For instance, some people might be interested in being a DSP, but they have, they can't get a driver's license because of the expense, or they have outstanding traffic fines or fees. And so what we're interested in studying is there a way to do sort of a forgiveness program similar to a student loan forgiveness program, where if you commit to working as a DSP for a certain amount of time, you could get forgiveness for some of those administrative fines and fees or barriers that you have. So we're going to be asking to do a study on that. So those are our main priorities for the session.
Great, thanks so much, Caroline. Representative Butler, I want to turn to you. I want to talk a little bit more about all of your work on the dental issue in a moment. But before we get to that, are there any other pieces that you would like to put out there in terms of the system overall, both as a legislator and as a family member?
So I was listening, yes, thank you so much. So I was listening to Caroline speak about employment, and my son is in an ICF, and Derek has probably been there 20 years now. And the challenge has always been caretakers and getting those people to retain those caretakers in those jobs. And she's right, that gap we have in funding that is never reviewed or updated all this time, it's hard because it becomes competitive. So if you have another waiver system, you know, a huge waiver system program in that area, and you have another ICF, they're all competing against those same pool of workers that we have in those areas because of pay raises and the funding they get. And so that is a big issue that I feel like that we need to spearhead when it comes to employment in the pool. I will let you know that the ICF where my son goes, they've even gotten where they've reached outside of their area and they have actual drivers that will pick them up. So if they have some of these fines and their driver's license or, you know, the way it is right now, and they have traffic fines, they're in that area with the vans they have, they pick them up and bring them to work and bring them back home. So they have started doing that. I know that the mandate problem with the vaccine has become a big talking point because, you know, you have people that want their choice not to be vaccinated or to be vaccinated. So, you know, that kind of came to a halt with hiring in some of our ICF. So I am totally in agreement that we have got to review these gaps, I think yearly, to see where the funding falls, because, you know, I also work with Holy Angels in Shreveport, and a lot of our waiver programs, especially with Miss Kathy and them, you know, they keep me informed of that. But we have to get those fundings, you know, up to scale so they can run these properly. You know, the elephant in the room is that we don't want abuse. You know, we want to make sure that we have the proper caretakers in those places, in homes, community-based or wherever it's at, that we have the proper caretakers and the background of those people taking care of our adults and our children. And so we've got to look at that. I will let you all know I do have some Zoom calls coming up in the next week with our congressman. And Kennedy, Senator Kennedy is a really big advocate for me, and he does sit on appropriations on the federal level. So I call him probably weekly and I have someone watching all of the bills that are coming through when someone's after our money on a federal level to, you know, spearhead that and cut that off. And he's voted against far and against anything I've asked him to do. But we really have to face those challenges and get that funding up where we need it so that we can get caretakers in those community homes and waivers to work. And going forward with the dental plan, I meet next week with our governor to fund our dental plan again and to also add ICFs to the dental plan. So I know what my funding has to be. I know where I have to be with that. They're all on board. I can tell you my colleagues are in full support, and I'm very grateful for that and thankful. Anyone that we can get to advocate for us, to call your senators and your representatives and your governor, is huge. They listen to that. We have a lot of special needs parents. You know, what a lot of people don't realize is how much that affects everyone's lives. There's someone in each family's lives. Every one of my colleagues all come to me and say, you know, I have a niece, or I have a godchild, or I have a grandchild, or I have a child, or I lost a child. And so they're affected directly or indirectly some way. So they get it. It just took a voice, I think, someone to, you know, for God to put a special needs mama in there and say, look, you know, these are the issues we're having. So, but I definitely agree with Caroline and Heather and everyone on our funding gap. We have got to get that where we need to be to do what we need to do productively and efficiently and for the safety and welfare of everyone there.
Well, thank you so much, Representative Butler. I'm starting to hear some common themes, and I'm taking notes for some things to revisit as we continue our discussion. Kathy, I want to bring you into the discussion. If you could talk a little bit about the themes that you're seeing, the challenges, the opportunities within the system.
Caroline and Rep. Butler pretty much touched on a lot of them that I've observed. My daughter was one of the first individuals who participated in the home and community-based services program when it was first introduced in Louisiana back in the 90s. So I've kind of experienced the whole realm of the service system, but I've had several providers and have been trying to learn as much as I can so that we can get the services that she needs. One of my biggest concerns that everybody has touched on is the shortage of direct support professionals. And as I understand it, there are several reasons for that. Definitely the low pay. You know, we're very grateful that the legislature appropriated enough funds so that there could be a $2.50 wage increase, but that doesn't even touch what their real pay should be. When you think about what other industries pay their workers, you know, and the kinds of job that our workers have to do and the responsibilities that they have in caring for our loved ones, they definitely should be paid more. Along with that pay, though, I think there needs to come some more robust training than what's currently offered. I would like to see the state start investing into more competency-based training. When I had worked at LSU Human Development Center years ago, we started working on a training program, and I believe there were some courses that were being offered at Delgado. I would prefer seeing that there be some kind of certification process required. While some may think that might prevent people from working, I think we'll get more quality workers and they'll stay longer because then there'll be a career path. But again, you're going to need the money to go along with that. And as Rep. Butler says, we definitely have to make sure we include the ICFDD residents in the comprehensive dental care bill. That was something we wanted to do in the beginning. Unfortunately, we ran out of time because there was a deadline to find the bill and there wasn't enough time to figure out what the actual fiscal cost would be. So we had to pull it out, and that's why Rep. Butler proposed the resolution for OCDD to conduct the study and Medicaid to conduct the study of what that cost would be so that they can be included. And now it's my understanding that they have come up with that cost, which I can talk about more later when we talk about dental services. We definitely need to make sure our loved ones are safe when they're in the hands of the direct support professionals. And Rep. Butler touched on that a little bit. The elephant in the room has always been abuse, and I think we need to bring that out in the open and make sure that abuse does not happen. I would like to see, and actually on the state advisory committee, we're starting to look at what that process is. So hopefully we can see if there's any loopholes or gaps that need to be addressed to make sure when there's any suspicion of abuse, it's investigated quickly and the families are then receiving a report what the investigation turned out to be. I think everybody else touched on everything else that was of my concern. The support coordination services, definitely there's been a lot of turnover in that industry as well. Primarily, I would think because of pay. I can't tell you how many support coordinators I've been through over the years. So we definitely have to build that system up. I am grateful compared to years ago from when we first started this service system that our legislators are in 100% support of us, and hope to see that continue because these are critical services for our most vulnerable population. And I want to know that these services are firm in place once I'm no longer around. Thank you.
Thank you so much, Kathy. And I think, having that experience as a family member just really highlights the needs that we're talking about. Heather, I want to go to you now just as a service provider. Talk to us about what you're seeing from the provider perspective. How are these issues materializing for you as a director of a program? And what do you see as some of the future directions for the service system?
I think that my sister is yelling at me actually right now. Bye, Katie. I think that everybody here has brought up some really good ideas and has brought up some real concerns in some areas where we really need to take action. I love the ideas about looking at fines or other charges that are minor that might allow us to be able to bring staff in. Our staffing, as everybody has said, is always a challenge. Finding, recruiting, and retaining these people is a challenge. And so getting some folks in the door by assisting them. I love the idea of the transportation to and from work. I like hearing that kind of ideas, but getting people to work is a great idea, and getting them started and onboarded at Volunteers of America would be wonderful. I think retention, of course, there's a financial piece, but I think training is a component of retention. Well-prepared staff, well-trained staff provide the best care. They reduce the possibility of abuse, neglect, and they're able to stay in a position longer. They feel confident about making the decisions with the consumers. So I love those ideas. I think those are great. We would like to see more training for our direct support professionals, more funding to allow them to work with others, other DSPs, or the consumers longer would make for great service delivery.
Excellent. Well, thank you all for those insights. As I began my work at Volunteers of America and started to talk to folks that led our intellectual and developmental disability services programs, one of the immediate needs that was brought up to me was the need for dental coverage amongst our consumers with intellectual and developmental disabilities. And so it was just so exciting to see all the work that went into a bill last session to provide dental coverage to those receiving home and community-based services, and then the effort to extend that to intermediate care facilities or the group homes. And that is thanks to the two of the folks in particular on this call, and Representative Butler, who brought that bill last year. And so Representative Butler, could you just talk about kind of what led up to the bill and then the study, and then talk about kind of where we are now? Are you looking to bring, will there be legislation on ICFs, or will it simply be an appropriation? Kind of where do things stand as far as kind of completing the deal with dental coverage?
So, experience is usually what drives some of my legislation, and that's not always my favorite thing to happen. But during all of that, Derek had an abscessed tooth and we landed in the hospital during the hurricane. And we had to stay there, and it was an abscessed tooth, which was nothing, but due to the fact that these children are not where you can just put them on something. Usually it affects their stomach or their system, and you've got to get through the medication to see if we can even, cure the infection for the abscess. You land in the hospital like we did. He couldn't tolerate the meds. They were too strong. Ended up on IV. We were there a week. And then the minute after that, you've got to start finding a dentist that will do the work. And that was a big problem. And also the hospitals accepting the room to put them in there. So one of the big challenges was, first off, I realized, the only way Derek gets dental care is if we land in the hospital. We've got to change that for all of those children. And the second thing was getting someone involved in that team, which was Kathy. She was huge for me because I have like 8 bills, I think, going at one time that session. And so it was unbelievable trying to navigate all of that. So she was huge for me for the information and for the support. And the second was Dr. Donaldson. I was introduced to him and he was brought on board because he understood. He's a pediatric dentist and they see special needs children. And he understood that the hospitals were not having that many rooms and openings for these children because, why would they do one patient that took 1 hour where they could do 10 ear tubes in an hour? So it was all about the money. It's always about the money. And so the way we did that was I had him spearhead getting units in the hospital, the funding for that raised. So it was more enticing for them to take a child or adult of special needs and then giving the anesthesiologist more money to provide those services. So we had all these things going on at one time. And, by the grace of God, we pulled that together. So Kathy was working on that end with the dental, feeding me the information I needed. I was working with our legislators, and Dr. Donaldson was spearheading the other side. And it just all came together at the very end. And she's right about the ICF. ICFs are included all in one per diem. It's one solid group of money that comes down from the federal government, and everything is in there. Your caretakers pay, your, whatever, the food, whatever has to be provided for that child or that adult is in that one group of per diem. So I didn't have enough time to dissect that. I ran out of time. So I'd hurry up and threw the resolution in there for the study to get the amount I needed. So going forward, I am looking to get it just appropriated. I have the legislating sitting ready to be filed. I've done it already. If I cannot in the next month get it appropriated ahead of time, I'm going to file it. And then I'm going to go for it after that. And I don't feel like I'm going to get turned down. I just don't. They are very excited about what I do. So, and very supportive of what we do. So that's going forward. That's what I'm looking at. And I feel very confident about it.
That's outstanding. And that's really exciting that, we have the coverage now for those receiving home and community-based services, and that looking forward into the next year, that'll be extended to group homes, to the ICFs. Kathy, anything else you want to add to that, just in terms of all of the background work that went into making this a reality, and, to what we look forward to in this next appropriation cycle, extending to the ICFs?
Yes, I mean, Rep. Butler certainly hit on a lot of the important points, and we're certainly grateful for her and all the legislators for supporting the legislation. I have to say, in my experience, the bill passed unanimously in all committees, and I've never seen such support in a long time. But this issue started when I and another family member were both on the State Advisory Committee expressing concerns about having trouble finding dental services for our loved ones. Mary Kay Cohen was on the State Advisory Committee first, and her brother Tommy was having difficulty, they were having difficulty finding dental services where he would probably require sedation or anesthesia, and I was having the same problem. The last time my daughter needed services, it was a major hunt. I mean, it took, we've called so many trying to get help, and we ended up being referred to the dental school program at University Hospital, where they provide the dental service with anesthesia, but that bill was over $3,500 and not covered by Medicaid at all, because dental is not covered. Not even the anesthesia or the facility fee, nothing was covered. So after several meetings of discussions and so forth, I had proposed to the State Advisory Committee that we formed a task force. And that's when we pulled in all the players. We have people on the task force that represent, that are parents, siblings, private dentists, hygienists. OCDD was on it, Medicaid, the Louisiana Dental Association, ARC of Louisiana, the LSU School of Dentistry, managed care organizations, Dental Lifeline Network, Wellhead, lots and lots of people that had the same interest in this. And we met once a month and started listing what are the needs and what are the barriers. And once we listed all of that, then how can we resolve those barriers? And we came up with recommendations and provided a report that we submitted to the Louisiana Department of Health. But we felt we needed more. So that's when Mary Kay and I decided we would reach out to our legislators to see who would help us with the bill. We decided we needed the funding first for dental coverage. So we reached out, and Rhonda Butler responded immediately. And to this day, we are so grateful for all her hard work and advocacy for us. So it was originally a bill where it was going to cover both those on home and community-based services and both those in ICFDD facilities. But as I mentioned earlier, we had to pull that part out because Medicaid needed more time to figure out what that funding formula needed to be. Since then, as I mentioned, we've submitted a report to Louisiana Department of Health. We passed HB 172, which is now Act 450, providing comprehensive dental services to adults with developmental disabilities who are on any one of the waivers. The comprehensive services includes diagnostic, preventative, restorative, endodontics, periodontics, prosthodontics, oral and maxillofacial surgery. That's always a hard one to pronounce. Orthodontics and emergency care. We've even learned about a special code that could be used by dentists that's for behavioral supports in case they need a little more time to work with an individual with a disability during the dental exam and cleaning or doing any kind of restoration work. And then we are now we're working with the LSU School of Dentistry and others in developing more robust training for the dental workforce, but both students and those currently practicing dentistry. We've also, Dr. Frank Martello, who's been a big player on our task force, was able to obtain a $100,000 donation from United Cerebral Palsy of Greater New Orleans that would be used partly toward training for dental students and another for services for adults with developmental disabilities. We've also been able to find, by connecting with some national partners, find some free online training in special needs dentistry that we provided to the deans at LSU Dental School, and they've made that available to all their dental students. And we're hoping, and the Louisiana Dental Association will be making that available to all their members and announcing it coming up in one of their monthly articles. I think they're going to be publishing monthly newsletters. And then we are currently working on adding 2 components to the dental curriculum, and hopefully we can get this done. This may take a little more work, but we're working with OCDD, particularly Dr. Bonnie Kelly, ARC Louisiana, Kelly Monroe, and Ashley McReynolds, and Karen Scallon with Special Needs and Parent Support Services to develop a parent-family caregiver component so that the dentists can learn about what it's like to be a parent, what it's like to provide the care, what kind of supports we need, or maybe some adaptations or adjustments in terms of what the dental care needs to look like. And we're hoping to develop a behavioral supports component as well to train all the professionals so they can have a little bit more background in positive behavior reinforcement, so that hopefully more of our loved ones can receive the services in their office as opposed to having to go under anesthesia. So that's where we are right now with the task force.
Thank you so much for that, Kathy. And it is really just exciting work. I've come to realize that Louisiana now is truly a national leader in this area of providing dental care for people with intellectual and developmental disabilities. And it's just getting started. But other states now are looking to us. And as you said, Kathy, I mean, it was amazing to see the real support in the legislature. And that's just a credit to all the background work and then all the legislative work from Representative Butler. So thank you to everyone involved in that. I want to switch gears a little bit and go in another direction. But before I do, I want to remind everyone, if you do have questions, please put those in the chat. I haven't seen any come through so far, but when I do, I will try to get to as many as I can with the time we have remaining. But I wanted to turn to you, Caroline, and if you could talk a little bit about things that are happening at the federal level. I know that the proposed Build Back Better plan that passed the United States House of Representatives, it included $150 billion for developmental disability services. That is moving over to the Senate and is being debated. Could you talk a little bit about, what's happening at the federal level, what that would mean for us here in Louisiana, and how folks here on the call might be able to get involved in making that a reality?
Yeah, absolutely. So Yeah, so as Nick said, the Build Back Better plan, and just as a reminder, this is the sort of partisan infrastructure bill, the human infrastructure bill that is, going to basically pass or not pass along partisan lines. So that has passed the House and is now in the Senate. It does include $150 billion for home and community-based services. So again, that's just, those are the Medicaid waiver services where people receive disability supports in their own homes. This would not include the ICFs, which is just something we have to bear in mind if this does get passed and the money comes to Louisiana. But essentially, states would get additional Medicaid dollars from the federal government to spend on home and community-based services. And there was also a provision for home and community-based services in the American Rescue Plan Act that passed earlier this year. I would imagine that if this bill passes, it will have a lot of the same provisions for home and community-based services. So this would basically, if states accepted this money, they would need to invest it in the home and community-based services system to strengthen and expand those services. So that can take, there's been a good deal of flexibility for how states can do that. They can invest in the direct support workforce, which we've talked a lot about, by increasing wages, recruitment, training. I know another component that's included in the Build Back Better plan for this funding is that states, if they accept the money, have to do a regular review of Medicaid rates. So this is what we were also talking about earlier. One of the issues we have in Louisiana is that Medicaid rates are not regularly reviewed for adequacy. And so they get out of date very quickly, and providers cannot keep up with costs when they're getting a fixed rate from the state. So Build Back Better would require that states, this funding within Build Back Better would require that states review Medicaid rates regularly, which would definitely be a boon to us. So it is in the Senate. This bill is in the Senate right now. As I said, it's a partisan bill, so I'm just going to say unlikely that our senators would end up voting for it, but it's important to, I think, reach out to both of our senators and let them know that this provision specifically is really important to us as they're considering sort of which provisions might end up in or out of the bill. I would encourage, and especially Representative Butler, knowing that you have such a good relationship with Senator Kennedy, letting Senator Kennedy and Senator Cassidy know what these dollars would mean for us in Louisiana. And we actually have, the Community Provider Association has some language around that to help people reach out to senators. And Nick, I'd be happy to share that with you if you wanted to share it with these participants.
Yeah, that would be great. And as Caroline said, I think even if our senators aren't likely to vote for this, I think educating them about the importance of this funding, just as they talk with their colleagues, and as the bill continues to be fine-tuned, because it does look like it is something that is likely to pass, and making sure that this funding is included is critical. So I'll definitely send that around to everyone who's on this call. If you send that my way, thanks, Caroline. Representative Butler, I did want to come back to you now. First of all, if there's any reaction you had to that, in terms of the federal advocacy, that would be great. But I also wanted to ask you on the state level, we've talked about how there's a lot of funding for home and community-based services, both federal, and then we had the rate increase this past session. And so, as Caroline mentioned at the beginning, from CPA's perspective, looking at trying to get that $8 to $9 million appropriation for intermediate care facilities. What do you think about the prospects of that in terms of this upcoming session? And what advice do you have to those who are on this call, again, in terms of getting the message across to that there needs to be this parity between the ICF rates and the home and community-based rates?
So, I feel like since I've been there, no one was educated about this. No one really understood what this meant to waiver programs and in-care facilities, and just the basic need for, developmental disability adults. And it took me to educate them. And when I would sit in those committees and talk about my experience and educate them on what life is really like when you are raising an adult or a child with a developmental disability, it kind of gave them that woke moment of that's really going on. And I know that they all say it touches every part of my life, and I have someone in my family life, but until you live it, it's a whole different scenario. They don't get it. And when I started to let them know what my life was like on a daily basis or a weekly basis, they were in awe over that. In fact, in one of the speeches I gave, they all stood up and gave me a standing ovation. And I was in shock because that's my life. And that's what I live. And it wasn't that big of a deal to me. But when I saw that, I realized they just don't know. They just don't get it. They don't know. It's because they've never been told or educated. So I think we need to have more meetings, bring in more of these legislators. I have so many meetings coming up and so many calls, and it's for this kind of legislative luncheon, and it's for this, the judges want to see me, or I have, your ag departments and your natural resource, but I don't have any where we gather these legislators to inform them and educate them on what's going on with these adults with disabilities. And they need to understand that where I made them understand in some of these in-care facilities, there is no parents left. Some of them have passed away. So that's the only family they have or understand. And you can't just put these children or adults with disabilities in a nursing home. That's not a scenario for them. They need to have options, because not one size fits all. And that's the thing with the waivers and the in-care. And that's why I'm so supportive of all, because some of us can do those waiver programs and have caretakers in there. In my scenario, I don't have any siblings that can take care of Derek. I don't have any other children. They're stepchildren. They live in other states. So he has no one. If something happens to me, that's going to be his family. And that's why I made that choice. So we need to educate my colleagues and our congressmen. We need to go up there and advocate for this more. I believe that. And I think you see a team. Look, there's a lot of us that have these adults and children. We show up on that doorstep. It's going to show some support, and they're going to recognize us. They're going to see what's going on. But we really do need to have more meetings and educate them as a whole, I believe.
I think that is so true, and that goes such a long way, just sharing those stories and just informing. I know, legislators are often drinking out of a fire hose, and so, it's really breaking it down and making it personal, and having them hear it from multiple people ultimately. So we have about 5 minutes left. So I'm gonna ask y'all a final question and ask that, if you could try to answer within a minute. But before I do, I saw that we had one question come through about Build Back Better advocacy. As Caroline mentioned, she has something that we're going to send around, and there's some other resources that we can send around to everyone. But I also wanted to acknowledge Karen Scallon has a comment here that said the work done on the Adult Dental Task Force is probably, let's see, and I'm trying to get the whole message, but basically she was saying it was one of the best things that has happened, in the developmental disability service system in some time. And I want to build off of that. How can we use that template to tackle the next issue? And so how can we use our collective voice to, take on the next challenge, whether that be these workforce issues or whatnot? And what do you think that issue might be? So that's a lot, I know, but Caroline, I'll put you on the spot first. And then, if we could just do 1 minute, and that'll put us right at our closing time.
Right, I'll do my best. I mean, I think I think that the work that the Dental Task Force did, I think the most important thing was just the collaboration among all of the different stakeholders who care about people with disabilities and disability issues. So that is the Louisiana Department of Health, the legislature, the provider community, and the people with disabilities and their families. And I think that that group all came together and saw an overlooked need and coordinated with a unified message and got it done. And I think that's just, that's the way to do it. There's so many people working on these issues, but we all generally have the same goals. And so I think recognizing that and working together. And what will the next issue be? I mean, I think it's going to be having a systematic way of reviewing Medicaid rates and making sure they're adequate and getting that done once and for all.
That's great. Heather, I want to turn to you next.
Hi, excuse me, thank you. I am excited also about the work that's happened for dental care for our population. It's really exciting that's becoming available to them. And I also agree that the workforce issues are a primary goal for me and for the work that we do. I was thinking, as everybody spoke, about a consumer who called me recently, and her family called me and she'd been passed between provider agency and nobody was able to staff because of the unique needs, and they were having trouble finding the beds. And I just worry about the people who won't get the care they need. And so I continue to think that's the focus for the future.
Excellent. All right, Kathy.
Thank you. I'm being a little distracted by my daughter, Jenny. As y'all could see, she's wanting a little attention. But yeah, I think what made our advocacy efforts so easy is that everybody came to the table and worked together. And I can't say enough how that collaboration is so powerful. And I would be happy to work with any one of you on, pay issues or whatever, so we can bring everybody to the table and come to a consensus and share our one single message. I guess my real concerns, I think, as everybody has said, is the future of the workforce. As I mentioned before, there's going to be one day when I'm not here, and I like Rep. Butler. My daughter doesn't have any siblings, and I often am worried and concerned about what's going to happen afterwards. All the service system is important. I'm a strong advocate for home and community-based services, but I know at some point my daughter is going to need to live in a group home, probably. And I want to make sure those services are safe and secure and the best they can be as well. So I'm willing to work toward that. We just need to get our legislators, as Rhonda Butler has been doing so well, thank you to her, to understand what it is like to walk in our shoes. That while these are Medicaid services, it's not because we don't want to work. I worked my whole life trying to work and raise my daughter as a single parent. And so those services were important. When they came about in the 90s, I was at a point of having to decide whether or not I was going to be able to continue to work or not, because she was too old for the typical childcare. So what do you do? So we really need to stabilize the system, both with increased pay. And like I said, we can't stop at that $250, and more robust competency-based training, a career path for our workers, and making sure all the protections that can possibly put in place are there for our loved ones. And I think we can get there. I've seen a lot of great strides over the years that I've been Jen's mother. So I'm sure we can get to where we need to be at some point in the future. So.
Great. Thank you so much, Kathy. And Representative Butler, I'm going to give you the last word.
You know what? I'm also an advocate for VOR, the Voice of Reason organization. And I speak with them many days a month. They send me emails. They keep me updated on a federal level what the funding is looking like for us. I've gotten invited twice to go speak in Washington on their behalf for adults and children of disabilities, and COVID has stopped that. So hopefully this summer coming up, I'll be able to do that. So I'm going to bring my tough mama face, and I'm going to let them know what's going on up there and bring it back to Louisiana. And I'm also going to let them know that we are the model for the dental legislation that's coming from our team and us working together. And they need to stand up and recognize what we're doing here. And by doing that, they should certainly try to help us going forward. So I want to let all of you know that. Hopefully that will happen this summer.
Excellent, excellent. Well, this has just been such an inspiring conversation. We know there's much work to be done, but I think with all of us involved, we'll get it done. And some of the issues we've raised up have been a perfect example of how we can do that. So thank you all on this call for joining us. Thanks especially to Kathy Dwyer, to Caroline Meehan, to Representative Rhonda Butler, and to our own Heather Matthews for being with us. And we hope you have a great afternoon. And thank you for joining us. If you'd like to learn more about our services, you can go to our website. It's www.voasela.org. You can also find recordings of all of our past community forums and information about future community forums on the website. And I will be sending out the recording to all registrants along with some follow-up materials. So once again, thank you all for joining.
Thank you. Love you guys, and I appreciate you. Merry Christmas.
Merry Christmas.
Merry
Thank
Christmas.
you. Merry Christmas.